So, welcome, Shawn. Thank you so much for being here and presenting this third in the four-part series of Maximizing Your Medicare Summary Notice. So, welcome.
Thank you for having me. Appreciate it. And are we ready to get started?
Yes, absolutely.
Wonderful, wonderful. Well, certainly thank you, Anna, for hosting today, and a big thank you to the team over Aging Together for partnering with us on this series. As Miss Anna said, this is the third uh, program in the four-part series, and today we're talking about maximizing your Medicare summary notice. I'm Shawn Smith. I am the state director for the Senior Medicare Patrol. And just to give you a short agenda, in addition to talking a little bit about the Senior Medicare Patrol, what we're going to look at today is, what is our Medicare summary notice? We're going to talk about those documents that you receive. We're going to look at things that we do before receiving those documents to help us maximize that document once it does arrive. Uh, we're going to talk about how to review that document and look at what's in there and what information it contains that could be helpful to you. And then finally, what we do after receiving and reviewing that document. So with that said, uh, just as an aside about the Senior Medicare Patrol and why we exist, as most of you know, our country spends about $800 billion uh, each year on Medicare and the Medicare program. And what we've discovered is that we lose 50 to 60 billion dollars a year to scams and frauds associated with Medicare. For Virginia, the way that shapes up is we actually spend about 11 to 12 billion dollars a year on Medicare, but we lose about 1.5 billion to scams, and that's going to be kind of the same across the country. Scammers are looking to defraud Medicare. They're looking in each and every state, every pocket of the country, and so by our state, we lose a considerable amount of money. And so the U.S. Department of Health and Human Services put together the Senior Medicare Patrol. It's been around for about 20 years, or actually close to 25 years, I should say. And its whole focus is to empower seniors, their family members, as well as their beneficiaries to prevent, detect, and report healthcare errors, healthcare fraud, and healthcare abuse. And we do that through outreach, we do that through education, and we do that through one-on-one counseling. As I stated, it was a program that's sponsored by the Department of Health and Human Services. And so they provide grants to all 50 states plus four U.S. territories to run this program in each of those areas. Each of the programs in each state, even though they do it differently, they all have their own version of education that they do, meaning they do presentations similar to the ones that we're doing today and the ones that are part of this series. They want to educate seniors about scams so that they can prevent, detect, and report them. But they also do outreach, meaning we go out into the various communities in which we serve and set up tables at various events, whether it's senior events or whether it might be annual events, festivals. And we want to make sure seniors get lots of information about scams. So we give out resources that help support their knowledge and empower them to prevent those scams from happening. And then we also do one-on-one counseling, which we'll talk about later, but we actually have an 800 fraud hotline in each state where seniors can call and get free assistance if they feel like they're a victim of scams. And when we actually find fraud happening, we partner with the Office of the Inspector General and share that information with them. In Virginia, the organization that received the grant to run this program is called the Virginia Association of Area Agencies on Aging. There are actually 25 area agencies on aging around the state. We call them AAAs, and they provide resources and services to seniors in a prescribed area or planning service area, we call them PSAs. And so this program partners with all 25 of those agencies to run the Senior Medicare Patrol. And so we have paid and volunteer staff in each of those agencies so that every member of the state and beneficiary of Medicare around the state has access to this program. And so we provide educational training, we go to outreach events, but we also distribute resources. And so if you visit our website online, it's at virginiasmp.com. You'll see some of the resources we offer. You can contact us and get in touch with us there. And so that's the Senior Medicare Patrol. And as I said, our big message is to prevent, detect, and report fraud And so today's presentation is really, as we're talking about our Medicare summary notice, we're talking about detecting fraud. Typically, when we get those notices, if fraud has happened on our account, one of the things that we can do with these documents is that it's to detect whether or not that fraud is happening. So, just getting started, the big question we want to ask ourselves is basically, what is a Medicare Summary Notice? We call it an MSN. It, of course, is not a bill, but if you have original Medicare, this is a document that you'll receive typically every 3 months that tells you what's going on your Medicare Part A and Part B services. And so, this document will come in the mail, like I said, every 3 months. And typically, if you've had a service in that particular 3 month period, it's going to show up on this particular document. In addition, other major information that it provides is it tells you what portion of any of the claims that have been contained in this notice, what were paid by Medicare, and then also what you would have to pay as part of your deductible or copay with your insurance. And we'll look at all of these things in a little bit more detail. Uh, as If you ask the question, when should I get this notice? So, as we said earlier, it usually comes out every quarter, every 3 months, but only if you've had a service within that 3 month period. If you haven't had a service, then you should not expect to get a Medicare summary notice. But if you've had any type of service in that particular 3 month period, then Medicare will send that notice to you. Now, if you choose to, you can choose to receive your Medicare summary notices online. So basically, you can open up a mymedicare.gov account, and then you can view these online. And in those cases, if you're viewing them online, you can actually look at them after a particular month closes out. So you don't have to wait 3 months to get these documents. You can see the previous month statement immediately once that month ends. And so you can always go online and look at the most current things that are happening on your account. Now, if you like, you can also write in to receive your Medicare summary notice in a large print format as well as a Braille format. So the online version you can get every month, or you can wait and get the paper version every 3 months. So, why is reviewing your Medicare summary notice an important thing to do? This document is something that the insurance companies use to basically kind of partner with you. What they want to do is when you have a service and someone puts in the claim, they want to make sure that you get your services in a timely manner, but also that doctors get paid in a timely manner. So they may pay a claim, but then they send this document to you so that you can review the claims that are showing up on your account. And if you see something that looks incorrect, you can notify your insurance company, Medicare, or any other supplemental insurance that you might have. Notify them so that they can investigate to see if they paid something incorrectly. And if they have, they can pull that money back into the system so that it's available for you to use later on down the road. But they want you to review these documents and alert them if there's something on this document that shows up that shouldn't be there. It's the best way of detecting whether or not there are errors, fraud, or abuse on your account. And so, before we get our Medicare summary notice, there's some things that we should probably do. And one of the things that we always recommend is that we recommend that people use a healthcare tracker. Now, what you see on the screen are healthcare trackers that we give out for free. It allows you to write down what's happening with your doctor's appointments and services or medical services so that when you get those statements 3 months later, you can review and compare to make sure there's nothing on that statement that shouldn't be. We give these documents, these booklets out for free, but you can use anything, any type of notebook that you have or journal where you can write down this information and review it for yourself. But again, the idea is I couldn't tell you what I had for breakfast yesterday. I'm sure couldn't tell you what the doctor did and what surveys they provided 3 months ago when those statements come, or even a month ago. And so writing down this information is very important. As I said, you can use any journal or notebook that you have. If you'd like to get a free healthcare journal, you can go to our website, virginiasmp.com, go to our contact page, send us a quick email with your address telling us you'd want a healthcare tracker, and we will ship it out to you for free. But again, it's just a booklet or something that you'd use that you'd write down what's happening with your medical services. And so one of the things that you want to write down, of course, are dates and times of your appointments, who you went to see, what date you went to see them, what was the location where you saw them, because that information is going to show up on your Medicare summary notices. If you received any supplies or equipment, such as durable medical equipment or anything in the time frame uh, of that particular Medicare summary notice, again, you want to write that stuff down as well. Same thing with prescriptions, or if you've gone to pharmacies for things, making sure that information is documented. And then any bills that you've paid or receipts that you have, if you paid for something out of pocket in the doctor's offices or paid up front for any services that you might have received. Again, noting that information could be super important because you certainly don't want your insurance company to go back and repay for something you've already paid for. So, writing down again dates, locations, physicians, equipment, prescriptions, and of course, any payments that you may have made are going to be key before you get that particular notice. So, once you get that notice, you're going to want to you're going to read that notice to figure out what's going on your account. So, typically, when you get that notice, it'll look something like this. And there are just certain parts of it that you really want to make sure that you're taking some time to review. And one of the first things is your name, mailing address, and your personal information. You want to make sure all of that information is correct. It being incorrect could be that they've mixed up your information with someone else's, which means that their information could be going on your account or vice versa. Your information could be going on their account. But verifying that your name is fully spelled correctly, if there's a middle initial that you do or don't use, making sure that is or isn't there, making sure that they've spelled your name correctly. If your name is hyphenated, however it should be on that document is what you want to verify. Then you're going to follow that by making sure that your Medicare number is correct. They have a portion of your number that's going to be revealed on that document and making sure that that is correct. We know in some doctors' offices, the people that are doing data entry aren't always as accurate as they could be. So again, verify that information is key. What this gray box will also show you is the date that this notice was mailed out to you, and then it shows you the time period in which it is representing. So anything that happened between June the 15th and September the 15th, 2011 for this particular document is what should show up on the document. Next, it'll show you your deductible status. Most people have a deductible with Medicare, and this will tell you how much of your deductible you've paid as well as what you've owed as you go forward with your medical services. Looking at the other side, what they tell you on the front page is a maximum amount of what you should be billed based on the claims that were submitted for this particular time period. And then below that, we'll show you who are all of the providers that have placed claims in this particular time period as well. And so all of that will be right on the very front page of your Medicare summary notice, giving you just a summary of what you're going to find on the inside. If we open up that notice, the next page will give you some more general information and really some really specific instructions about things that may arise after you read this particular summary notice. So it tries to navigate you through the document with kind of a title on every page so you know what you're looking at. And so this first box here, this gray box, really it's kind of telling you what this whole presentation is telling you, what to do with this particular document. So it's asking you to review this document in a way that's going to be beneficial. So it's asking you, do you recognize the names of each doctor or provider on this particular document? And then it goes into, did you get the services that are listed? Or if you've already paid the bill, making sure that those amounts are correct. So basically, it's guiding you on what to look at when you review this document. If you find fraud on this document, it's telling you what to do in those particular cases. So it instructs you on how to report fraud if you find anything that looks fraudulent on this document. As you go down, it says if you have questions, and it tells you who to call in case you run into some questions once you review the form. And then it gives you some preventative services that Medicare provides. So it's just telling you how to manage some of preventative cases for yourself. And then finally, here at the bottom, usually there's a somewhat of a seasonal message. So this one is telling you to get your pneumococcal shot for pneumonia. I'm sure in flu season they probably have information about flu shots and probably COVID shots as well. And so it's just general information to provide you with that some things you might want to think about regarding your medical services and medical needs. So if we keep going, we're going to get to the heart of the document that starts to show you the claims that you would be dealing with based on what's in this particular time frame. And so it'll talk to you about the type of claim that this particular notice is for. So this one is telling you about your Part B benefits, excuse me. And then it's going to jump down to start showing you more information about what they're defining in these particular categories as you get towards the bottom of this particular page. And so it gives you definitions. So what does it mean when it says, is the service approved? Or what it means when it says amounts to provide a charge versus the Medicare approved amount. So all of those definitions are there for you as well. Now, as we move into the actual claim portion, you'll see here it starts out with the date of service. And so June 18th, 2011 is the date of this particular service. And as you continue to read in that gray section, it'll tell you who the doctor is and their phone number. It also tells you the location that this service supposedly had taken place. And so all of that, again, helps you to determine whether or not this particular claim is fraudulent. If you don't recognize that doctor, you don't recognize that location, or that date of service is incorrect, then you could be dealing with something that could potentially be an error or some type of abuse or some type of fraud. But you want to verify that that information matches exactly what would be in your healthcare tracker that you would have written down on that day that you actually had that service. As you drop down to the next portion, this little area describes the claim that was placed in on your behalf. I'm going to pull up my tools here because I want to highlight some things as we go forward. So as you see, this is the actual claim that was put in and the coding that was put in for that claim. And then it asks, was the service approved by Medicare? And Medicare says yes. Here in the next column, it says the amount the provider charged, meaning the provider is allowed to charge a certain amount based on their office policies, but Medicare only agrees to a certain amount. So despite the amount he charged, Medicare would only maximally pay the amount that they've approved. And then Medicare will pay their portion that shows you what Medicare will pay out of that particular amount that they've approved, and then what you may be billed for that remaining amount. So again, what the provider charged versus what Medicare would actually pay, Medicare's portion, and then your portion if you would have to pay that. And so that's how they get to all of those numbers. A provider, again, can charge anything they want, but they agree to receive only a certain amount from Medicare. And that's the difference between those two numbers. Now, as we continue to go forward, again, Medicare approved the service, yes. And then when it gets here to this amount that you may be billed, what they will often do, as you'll see here with this next arrow, is they may put a letter next to that particular number, or it may be anywhere aligned in this particular row to alert you to notes or footnotes at the bottom of the page. So if you see A responding to this number here, if you follow that over to the bottom of the page, you'll see it explains what that A means. And because this particular individual has a supplemental insurance, that that portion that they may owe will then get forwarded to this supplemental insurance. And that's what Medicare is alerting you that we have taken this amount and we forwarded this claim to your supplemental insurance. And then they will respond to it as to whether or not that will be something that you would have to pay or whether they would cover that payment. All right. We're going to go on to the last part of the actual Medicare summary notice. Now, I will say that if you've had a lot of services within that particular time frame that this notice represents, then all of those services will be listed in that particular Medicare summary document. And so while we just only reviewed one claim, there could be seven or eight, 10, 12, or 20 different claims based on how many services you had in that time frame. So this is, again, this is just one document with one service in it. It could be many, many different services. Once you've reviewed all of the services and all of the claims that have come to you, you'll end up eventually reaching the back of this document. And on the back of the document, it tells you how to get more information. Let's say that you actually reviewed your statement and there's some information in there that you don't understand or you have questions about. It tells you what you can do to get more information. And so that's going to be listed right on the document. What's also listed there is if you don't agree with the way something was, a claim went through, whether it was denied and it shouldn't have been denied, or maybe it was a service that you did not feel like you received. If you don't agree with coverage, what this tells you is that you have the opportunity to file an appeal. And it gives you a date by which you need to file that. Usually they give you 120 days. And so based on when this document arrived, they're telling you that you want to file your appeal by January the 14th. And so on each document, that's going to be specifically spelled out for you there. And then it tells you if you need help filing appeal, it tells you who to reach out to. Usually it's your SHIP or VICAP counselor here in the state of Virginia, but that information is also going to be on that document as well. So everything there is going to be contained in the document. For some appeals, you can actually mail this document back to Medicare, and it allows you to fill out the information right here on the back of the Medicare summary notice. And so it's always wise to complete this and make a copy of it for yourself before mailing it back to Medicare. When you mail it directly back to Medicare, they know that the problem is contained within this document. You would have circled that the problem issue or the problem claim or claims that may be an issue for you. And they'll review those and launch an investigation and get back with you with what they determine. But that appeal form, again, is right there on your Medicare summary notice. So after we receive our Medicare summary notice, what do we do? So the first question is, is everything correct? And if everything on that document is correct, that you recognize the doctors, the date of services are correct, the claims are all correct, all the payment information is correct, then you can just simply file this document away. We say folks might want to keep their documents for 1 or 2 years. It doesn't have to be a long time. We don't say 5 or 10 years, but we say 1 or 2 years. The reason that may be something good to do is because some people have the same services repeated year after year. And unfortunately, sometimes there are errors where people get charged more for the same service in 1 year than they did in the previous year. Sometimes having those documents where you can compare those costs makes it easy to figure out if there are problems. And so 1 or 2 years holding onto those documents might not be a bad thing. Um, if there are services in this document that you feel were denied or have been filed incorrectly, then you want to take this document and reach out to those particular entities that may have done something incorrectly, whether it's your physician, if you feel like they've put in the wrong claim or the information that they've put in is incorrect, asking them to correct that information and resubmitting that claim so that it gets approved could be a very quick and easy way to resolve some issues. A lot of times, the people in the front offices at doctors' offices, again, they're not always super accurate with things. And so errors happen, and errors happen often. And so just alerting them to the error, often they can fix those things, resubmit those claims, and alleviate any issues that may be associated with it. Uh, if you don't agree with what Medicare has or has not paid, you can always file an appeal. And again, how to do that is going to be written right there on the back of that Medicare summary notice. And if information looks incorrect due to fraudulent concerns, or it could be an error, or it could be some type of an abuse, you can always reach out to us at the S&P. Again, our whole goal is to empower seniors, but also to help them rectify issues when it comes to things like errors in your Medicare summary notice, or maybe even errors with a bill. Basically, what that looks like when you call us is we just love to gather information and determine, what the best way is to handle that particular information. If you have documents that you're looking at, things like Medicare summary notices, then what we'll do is we'll collect those things from you and we'll look at those documents together. We'll walk through it with you to make sure that we have a clear understanding of what your concerns are. And then we do one of three different things. One, we can give you some simple instructions as to how to rectify that issue. Those instructions, like I said, in many cases can be super simple, but if things are a little bit more difficult, we can start making some phone calls with you. We will call your doctor's office or your pharmacy or whoever the entity is that the concern is surrounding. And we will make those phone calls with you. We'll get them on the phone and you have an extra pair of ears to hear what's happening, but you also have an advocate on the phone when that happens. And what that allows us to do is oftentimes doctors' offices will tell patients to do things that the office should be doing, such as resubmitting claims or researching claims. And we can say to that doctor's office, actually, that's your role, not the role of the beneficiary. So we can advocate on your behalf. If you feel so inclined as to provide us with the right authorization, we'll make those phone calls on your behalf. Some seniors will say that if I call Medicare, I'll have to wait 20 or 30 minutes before someone picks up and they don't have the energy to do that. Share your information with us, give us those authorizations, and we'll make those calls on your behalf, call you back and let you know what needs to happen next, but certainly partner with you the whole way till we get the issue rectified. For difficult cases, there's some things that sometimes we can't handle in our offices. We actually have access to Medicare investigators who are not accessible to the general public. And so we can turn your case over to those folks and they can start investigating from an internal perspective. And if we feel like that there are actual fraud actions happening, then we also turn those cases over to the Office of the Inspector General. And that would be law enforcement at the federal level. And they start to look for patterns in submission of cases. As I said, this is a national program and we all share national database. So as seniors are calling us here in Virginia, we're putting information about doctors' offices, locations, services into a national database. And if they're defrauding people in Virginia, they're also probably defrauding people in other states as well. And so folks from other states are putting in that same information. And what that allows the OIG to do is they start to look for patterns. They look for doctors' names that show up over and over again. They look for doctors' offices or locations or hospitals, and then they're able to triangulate that data to hopefully find and catch the criminals. But again, calling the SMP is certainly one way in which we can help you rectify the issues that may be happening, especially those that may have been derived from reading your Medicare summary notice. Now, typically with this particular presentation, though it seems a little short, there's always plenty of questions. And so I'm going to go ahead and open up to Miss Anna to see if there are any questions that may have come out of the presentation today.
So please, if you have, thank you so much, Shawn. That was very informative on a difficult topic. Um, so if you have questions, please go ahead and unmute yourself. I see, Lily, do you have a question?
Yes. First, thank you so much, Mr. Smith. That was absolutely excellent and so helpful. In reviewing my late mother's Medicare summary notices, you had just said that we could opt in for electronic. Is it like bank statements? Once you do the electronic, you will never get the paper, or can we get both? Thank you so much.
That is a great question. And from my understanding, unless they've changed anything, it's definitely one or the other. As you can imagine, if they can not send paper, they typically won't. And so people that usually get the e-statements, but there may be an option if you sign up for the e-statements that may allow you to, that unless they've changed anything, it's usually one or the other. But I've had this question before and they may be opting people into it. So you might have to do the online account and see if they give you that option.
Thank you so much.
Great, thank you. Great question. Any other questions from the group? I have a sort of general question, actually. I'm curious about, we often hear about the fraud and the abuse. Um, And I'm wondering, is that all attributed to intentional intentional fraud, or is some of this, what percentage is error?
Uh,
Um,
that's a great question. And so I'm glad you asked that. So as you notice from my mission statement, we talk about errors, abuse, and fraud. And so the government has very specific definitions around each of those. An error is exactly like it sounds. It's a mistake that happens. It's something that's unintentional. And typically, when people see it, they recognize it and they rectify it. Um, Abuse is basically what they consider to be, I'll put in my terms, what we call a systematized error, meaning many of the things that happen in a doctor's office as it relates to claims um, often happen through um, automated systems. You click something in your computer and it triggers some type of process and it's automated. And so if I am a physician, and whether it's through one of those automated processes or just through a manual process that we've, dictated, it's possible with all these claims that I could just be putting in the wrong claim for something that I'm thinking I'm doing the right thing. And because it becomes part of our process, it's an error that happens over and over and over again.
mm,
Certainly not intentional, but definitely wrong still. And so abuse would be, it's kind of a systematized error. Fraud is very different in that it is always intentional. And so for someone to prove that fraud is happening, they have to prove that it's intentional. And so that's what separates each of those. And so, whether or not what percentage is considered fraud, it's really hard to gauge. It just becomes a matter of whether or not they can prove intent. I will say though that the information that we provide to the Department of Justice through the Office of the Inspector General is super helpful for the program in that it does provide a number of tips in real time from around the country. We have to do a report that we give to Congress each year to kind of show the activities and the work that we've done. And each year, Congress has increased our budget as a program because they realize that the return on the investment is super great. And so, as I said, each year, the budget for the program goes up so they can expand the program in the various states so that they get those leads and get that information because it does help them put money back into the Medicare system. So, whether that's because they're catching errors or abuse or actual fraud, um, all of it is beneficial for the program and for what we do for seniors.
thank you.
Great question. I,
Lily, oh, I'm sorry, Shawn, go ahead.
I was just going to add, though, too, if you've ever been to the DOJ website, or maybe you've read some of the articles on AARP where they tell you a doctor has to pay back X amount of dollars or a hospital agrees to a
Mm-hmm.
settlement, these
Yes,
all come from the tips that folks get via the S&P or other sources. But that's the OIG and the DOJ doing their work of prosecuting these folks. And a lot of it, again, comes from tips from seniors like yourselves.
great. Wow, thank you. Lily?
Yes, really, Mr. Smith, thank you for the excellent work that you all do. It's so important. This is a question not directly on this topic, but perhaps you might be able to help us. I have a friend in Maryland who read an article about Medicare Advantage plans stopping coverage. And she in Maryland has been trying to figure out which plans. Because you work in this field, is there some website or something that could help her? She's very upset, but she hasn't been able to find a source of information. You may or may not be able to answer that, but I just thought I'd ask on her behalf. Thank you.
No, it's a great question. So certainly there's a lot of changes, a lot of economic changes happening and certainly affecting the medical field and medical insurance. I'm aware that there are some significant plan changes coming. I don't know that they finalized, or any of the companies have finalized any of those plans yet. I'm sure as we get closer to open enrollment coming in October, those a better understanding of what's available and what's not available will be coming out. I will say a great resource for everyone is going to be your VICAP counselors. VICAP stands for Virginia Insurance Counseling and Assistance Programs. These are counselors that are not insurance agents. They're actually sponsored by the U.S. Department of Health and Human Services to help seniors figure out the best healthcare program for them, whether it's a original Medicare plan or a Medicare Advantage plan or supplemental plans. They are licensed and trained to provide information to seniors to help the senior choose what's best for them. The difference between a VICAP counselor and an agent is like an agent, a VICAP counselor is known or represents all of the plans that are available to seniors via Medicare. Agent will tell you the same thing. The difference is an agent is incentivized differently by each of those plans. And while probably 90 or more percent of the agents are wonderful, there are some agents who would push you to a plan that's going to benefit them sometimes more than the beneficiary. Because the VICAP counselors are not incentivized by the plans, they have no incentive to push you towards something. And so their whole goal is to show you all the plans that are available so that you can choose what's best for yourself, so that you ask all the right questions and choose the right plan for you. When I learned about the VICAP agents, it was back in 2020. My mom was looking for Medicare, and we got her in touch with her Medicare agent. It was during COVID, and so her VICAP counselor, excuse me, in her area. And so my mom had to send information in because we were in the COVID phase, and so she couldn't go in the office. And they told her it would take about 2 weeks for her to get that information back. Well, in that 2 week period, my mom went to the grocery store and she ran into an agent who sat her down and gave her a great conversation. And when she got home, she called and said, "Oh, I got this great insurance, low deductible. I'm sorry, low premium, no deductible, no copay." And I got signed up for it. I was like, "Mom, but did you talk to your VICAP counselor?" She was like, "No, no, no, no. Uh, this is really good. This is really good for me. Again, no, low premium, no deductible, no copay." I said, "Well, let's call your VICAP counselor." We called the VICAP counselor, and they looked at my mom's information and she looked at the plan she signed up for. And they told my mom, "Well, you're right. It's a low premium, no deductible, no copay." But what the agent did not tell my mother at the time that she signed up was that they were not paying for her diabetic testing supplies, which would have cost my mom $200 or $300 out of pocket. And so my mom's VICAP counselor was able to give her some more information, and my mom was able to choose a better plan for her. And so, again, not to say that all agents are like that, but some agents aren't always going to be as honest as we'd like them to be. VICAP counselors don't have that incentive. You can get to your VICAP counselor by going to the website is V with four A's.org. It stands for Virginia Association of Area Agencies on Aging. You can hit Find My AAA, and it'll tell you the AAA or the area agency on aging that's closest to you. And those agencies are the ones that house the VICAP counselors. And so just tell them that you need a VICAP counselor, and they can help walk you through the process of choosing the best plan for you. So that was a long answer to a very short question. I apologize.
Yeah, no, that is great. Thank you, Shawn, and thank you, Lily, for bringing that up. And Lily's also shared a link in the chat for those of you who um, want to have a look at that as well. So thank you so much for that. Yeah, insurance business is very confusing sometimes.
Yes.
So, yeah. Are there other questions?
Could
And
Mr. Smith repeat that triple A one, please? The
Yeah,
V.
absolutely. So the website to the association for all of the AAAs, it's V as in Virginia, and then there are four A's. So it's VAAAA.org. And once you get to their website, it'll say Find My AAA, and you'll see a map of the state. And you click on it, it tells you exactly where that location is and all the counties and cities that they cover. And if you call them and tell them you want a VICAP counselor, they can get you all connected.
And I've just put that in the chat as well if anyone wants to take a look at that. Yeah, this is great. Any other questions? We have a few moments, so and we have Shawn here as a captive audience and expert. If anyone has any questions on Medicare issues. Yes, Lily.
I apologize for asking
Oh,
so many
that's
questions, but
wonderful.
I run a virtual support group of caregivers, so things come up, and this is such a rare opportunity. One of the men said that when he was caring for his late father, he paid out of pocket himself for a wheelchair out in San Francisco where
Mm,
his late father was. But then later, many months later, because there was so much going on, he noticed that that company also submitted to Medicare. So the gentleman who
mm.
ran that DME company got paid twice. So he was just wondering, this is almost like he said 7 years ago. Is there anything that he can do, Mr. Smith, given such a time lag? Thank you.
Great question. And typically, 7 years is far too long for anything to be rectified on those particular issues. Typically, I would say 2 or 3 years, if there's fraud that's noticed after the fact, um, is usually the time frame that they like to work within, and then also part of it depends on the type of fraud as well. So, um, a lot of times they are already investigating a lot of these companies, and it just helps their case when they know that, oh, this happened with this particular organization. But if it gets too far in the past, then it's typically not super helpful for them.
Thank you. And we have another question, Mary.
Yes, I'm just wondering, I've seen a form called the Appointment of Representative. And what I'm trying to do is if someone, say, has a problem and they can't communicate anymore or whatever, that, if you have a power of attorney, that works. But if you just need to like get their Medicare information to help them if they're incapacitated. Someone told me get this form, this appointment of representative, so that I mean, it only would come into effect, I guess, if someone couldn't speak for themselves. But I'm wondering if that's the correct form to do that with, and if so, I guess you have to do it in advance, right? Like you can't wait until they're incapacitated and then they can't sign it. So anyway, is that the right way to go about helping someone?
Uh, I'll be honest, I don't know enough about that particular form to give you any real advice on it. I was just trying to look it up as you were talking about it, and it is a Medicare directed form. I mean, a Medicare provided form. So I'm almost certain that what you're expecting is, or what you're claim, or what you're saying is exactly the correct way to use it. So yes, if I would say definitely prior to them needing the help would probably be the best way to do that.
Okay.
Thank
Um,
you.
and it looks like it gives you access to their medical information via Medicare. It's just Medicare's kind of a waiver that they're allowing you to do that on behalf of the other person.
Right. It seems to me like I'm actually not on Medicare yet, but my husband is. But it seems to me like we should all be filling this out because if you can't, like if something happens to the person and you can't call Medicare and give their information and try to help them out, you'd be at a handicap. But
Yeah, yeah.
okay. Thank you.
No, no problem at all.
Yeah, thank you for that question, Mary. I wasn't aware of that either. Are there other questions? Okay, well, thank you all so much for being here, and thank you, Shawn, for being here.
Yeah, if I could just say one thing in
Yes,
closing.
please, absolutely.
Sure. First of all, I appreciate you all again giving me the opportunity to share this info with you. And just, in response to some of the other questions I get, one of the things that people ask is, when I get these documents and I'm reviewing the information, as I said, as we've all seen, there's a ton of information, the location, the date of service, the physicians associated with it, as well as the claims. If one of two or those things don't add up, it doesn't automatically mean there's an error or fraud. I use the walks like a duck rule, meaning if there are two or three things that's off, specifically the date of service and the location, and the claims, then there's probably a problem. A lot of people may not recognize the physician's names that are associated with it, and that's because in many doctors' offices, some physicians are working under the names of other physicians, and so um, if everything else looks correct and that physician's name is the only thing that's off, then it's probably correct. But if you see two or three things that look off and fraudulent, then you certainly want to question it. But that's the rule I use, the walk like a duck rule. If it walks like a
Um,
duck and it's shouting like a duck, then it's probably a duck. And so um, hopefully that's helpful. Again, just wanted to also say that we do these presentations around different types of fraud all around the state. We'll attend church meetings, women's groups, men's groups, Rotary. As I said before, we'll even come to your cookout if you'll share your hot dogs with us. But we want to make sure people get the information. All of the services we offer are free. And please reach out to us if you feel like we might be helpful to you. And Anna, again, thank you for hosting and again for the partnership.
Thank you very much. And we at Aging Together very much appreciate the sponsorship and collaboration with Virginia SMP and all the work that you do to help older adults in our region. So thank you, everyone. I hope you have a great day. And as I mentioned, this recording will also be available online probably within the week. So thank you.